Hello, this is Dr. Hatem El-Aishi. I'm a professor of rheumatology at Cairo University. A common question that patients ask is, what is the difference between seropositive and seronegative rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease that causes inflammation of the joints. We diagnose it mainly by the description of the symptoms of the patient, a process that we call history taking, and by examining the patient. Then we have most of the medical information we need for making the diagnosis and for excluding the other medical condition that could be mimics of rheumatoid arthritis. In the process of diagnosing and assessing the patient, we also order some lab tests. Some of them are to assess the extent of inflammation in the body, and others are to document the presence or absence of certain antibodies in the blood of the patient. Those antibody tests are two: the rheumatoid factor test, RF test, and the anti-CCP test. They are positive in some but not all of the patients with rheumatoid arthritis. What is the difference between a positive and negative rheumatoid factor test? If the test is positive, then the patient has what we call seropositive rheumatoid arthritis. And if it is negative, then the patient has what we call seronegative rheumatoid arthritis. Some patients believe that seropositive rheumatoid arthritis and seronegative rheumatoid arthritis are two different diseases with different plans of treatment, different types of medications. Well, this is not true. Seropositive and seronegative rheumatoid arthritis are the same disease. To a great extent, they are one disease. We approach both of them in more or less the same way. As a general rule, seropositive rheumatoid arthritis is expected to be more intense than a seronegative one. This is a statistical fact, but at the end of the day, deciding on the types and the strength of the medications used in the treatment of rheumatoid arthritis depends on the extent of the actual disease activity and severity that is documented by the history and examination of the patient and investigations that reflect active inflammation, and not on the mere expectation of a more intense disease based on an antibody test result. Thank you.